Welcome back to Aspire Nursing Academy. Today we begin Chapter 2 of Behavioral Sciences, Life Cycle, Behavioral Aspects of Development, Death, and Bereavement. This chapter explains how human behavior changes from infancy to old age, and how nurses can respond with empathy, age-appropriate care, and professional support, especially at the end of life. Without wasting any time, let's start the video. Let's look at the objectives of this chapter. By the end of this video, you'll be able to understand psychological development at each life stage, identify Erikson's psychosocial stages, apply age-appropriate nursing care, recognize emotional needs at the end of life and in grief situations. Introduction. Human development is a journey from birth to death. Each stage affects our emotions, behavior, mental health, and social roles. As nurses, understanding these changes helps us build stronger, more therapeutic relationships with our patients. Let's begin with the developmental stages. Infancy, from birth to 1 year. The main challenge is trust versus mistrust. Babies form emotional bonds with caregivers and respond to comfort and security. Nurses should provide consistent care, promote bonding, use gentle touch and voice to soothe the infant. Toddler 1 to 3 years, this stage is about autonomy versus shame and doubt. Toddlers begin exploring their world, saying no and expressing emotions. Nursing care includes giving simple choices, encouraging independence, keeping the environment safe. Preschool 3 to 6 years. This stage deals with initiative versus guilt. Children ask many questions and engage in pretend play. Nurses should use play therapy, provide reassurance, encourage imaginative play and simple explanations. School age 6 to 12 years. This is the stage of industry versus inferiority. Children learn rules, teamwork, and gain self-esteem through achievement. Nursing care should involve explaining procedures in simple terms, encouraging peer contact, praising efforts. Adolescents 13 to 18 years. The conflict is identity versus role confusion. Teenagers seek independence, form self-identity, and may show mood swings or risk-taking behavior. Nurses should respect privacy, educate clearly about health and body changes, encourage open communication. Early adulthood, 18 to 40 years. The focus is on intimacy versus isolation. This is the time of building careers, relationships, and emotional connections. Nurses can support mental wellness and stress management, offer guidance on relationships and family planning. Middle adulthood, 40 to 65 years. Here we face generativity versus stagnation. People may experience parenting, career stability, or a midlife crisis. Nurses should promote health screenings, address emotional changes, encourage a balanced lifestyle. Late adulthood, 65 years and above. The final stage is ego integrity versus despair. Older adults reflect on life, may feel lonely, and face physical decline. Nurses can encourage social interaction, provide emotional support, ensure dignity and respect in care. Now let's explore death, dying, and bereavement. Dying is not just a physical process. It includes emotional, psychological, and spiritual experiences. How a person dies often affects how the family grieves. Nurses must provide dignity and comfort, respect beliefs and end-of-life rituals, be a calm, non-judgmental presence. Let's start with Kubler-Ross's 5 stages of grief. These stages, developed by Dr. Elisabeth Kubler-Ross, describe the emotional responses people often go through when facing death or major loss. 1. Denial. This can't be happening. A temporary reaction of shock where the person refuses to accept reality. Why me? Feelings of frustration, blame, or unfairness are common here. 3. Bargaining. If I do this, maybe I'll be okay. The person may try to make deals to change the outcome. 4. Depression. Deep sadness, crying, and withdrawal may follow as the reality sets in. 5. Acceptance. A calm understanding and readiness to face what's coming. Not everyone goes through every stage, and not always in the same order. Now let's briefly look at the nurse's role in each stage of grief. In every stage, our goal is to provide empathetic, non-judgmental care, meeting the patient or family where they are emotionally. 1. Denial. Offer quiet support. Answer questions honestly, but don't force information. Just being there matters. 2. Anger. Stay calm and composed. Remember, the anger is not personal. It's part of the grief process. 3. Bargaining. Listen with empathy. Avoid offering false hope, but support their feelings. 4. Depression. Be present and available. Let them express sadness. Offer psychological and spiritual support if needed. Acceptance. Respect silence. Help with final wishes and comfort both the patient and their family. In each stage, nurses act as emotional anchors, helping patients move through grief with dignity and compassion. Now let's define bereavement. Bereavement is the period of emotional adjustment after a death. It's different for everyone and influenced by culture, religion, personal history, and how close the relationship was. Common grief reactions include sadness, guilt, anger, insomnia, loss of appetite, crying, or social withdrawal. In some cases, it may develop into complicated grief or even depression. Nurses must be empathetic, provide mental health referrals if needed, respect cultural mourning practices. Chapter 2 complete. Understanding behavioral development through the life cycle, from infancy to death, helps us become more empathetic, patient-centered, and effective in nursing care. The next chapter will be uploaded soon, so stay tuned. If you found this video helpful, please don't forget to like, share, and subscribe to Aspire Nursing Academy